Okay. All right, this is Carolyn Jones, integument assessment for week 3. And I have with me, from the knee down, a white male, 40 years old, who is a part-time college student and also works close to full-time. And he came in with a spider bite that got a bit out of control. So I'm going to ask a few questions just while I go through the video. So do you smoke currently?
No.
And do you drink?
Occasionally.
Occasional drinking, no smoking. And what is your activity level? Do you exercise every day or sometimes?
Twice a week.
Twice a week. And what kind of exercise is that?
Walking.
Okay, walking is good exercise. And what about at work or at school? Do you have a lot of physical activity, or is it more sitting down?
Sitting down.
Sitting down at work and at school?
Mm-hmm.
Okay. And your home, do you have any steps leading into the house?
No.
Do you have any staircases in the house?
No.
And in the bathroom, do you have any, do you have a walk-in shower, or is it a tub that you have to step up and over into?
A tub.
Okay. And do you have handrails or any elevated toilet seats?
No.
Okay. Do you feel the need for any of those?
No.
How do you walk? Do you walk on your own unaided, or do you use a walker or wheelchair or other type of device like crutches or a cane?
I walk normally.
You walk normally, so you don't need any device.
No.
Do you live at home alone?
No.
And who's at home with you?
My wife.
Okay. And your wife is physically capable of helping you out while we have this wound issue?
Yes.
You better say yes. So, this is my husband, Dr. J. Okay. So what kind of shoes do you normally wear?
Tennis shoes.
Tennis shoes. Do you ever wear anything besides that? Dress shoes, flip-flops, anything like that?
Yep.
And what do you wear the most of?
Tennis shoes.
Okay. Do you have any allergies to any medications or anything else, such as foods or latex?
Penicillin.
Penicillin? Okay. What about any types of topical creams or ointments?
No.
Okay. Are you on any current medications?
No.
Okay. Do you have a cardiovascular history, like heart problems, previous heart attack, vascular disease?
No.
Circulatory diseases? Any previous broken bones?
Yes.
And what bones have you broken in the past?
Ankles.
Both of your ankles?
Twice.
Twice. Both of them twice?
Yes.
Okay. Just making sure I'm clear. Any types of balance or muscle spasms or any epilepsy or anything like that?
No.
Kidney disease?
No.
Liver disease, lung disease?
No.
Okay. What about gastrointestinal? Any type of stomach problems?
No.
Are you able to use the restroom on your own?
Yeah.
Okay. And any other skin issues besides this issue that you've come into for today?
No.
Any burns or other open wounds? No?
No.
Okay, patient's shaking his head no. All right, so you mentioned that this was a spider bite. How many days ago did this happen? 3 days?
3 days ago.
3 days ago? Okay. And did you put anything on it at the time? Any creams or ointments?
No.
Have you received any treatment before today for the spider bite?
No.
And was the opening of this a result of scratching, or did it just happen on its own?
It just happened.
Okay. Have you used any types of creams, ointments, coverings, or anything, bandages on it?
A Band-Aid.
You had a Band-Aid? Okay, I think maybe this is outgrown Band-Aids at this point. Have you had any tests, MRIs, or vascular studies or anything done on this particular wound?
No.
Okay. So right now what we're looking at is just looking at the involved leg. You've got hair growth. There is no edema here, so I'm not seeing any signs of arterial insufficiency as far as the hair growth. The skin looks healthy and pink and good color to it. As far as venous insufficiency, I'm not seeing any edema. And we've got, good growth on the toes. The toenails look nice and clean and long. There's no signs of a fungal infection. There's no signs of any type of skin breakdown here. I'm going to pick up your leg and look at the bottom of your foot. And looking at the bottom, sorry about the light there is no ulcers, no wounds. The skin is fully intact all the way in between the toes. You can see that his heel right here, nice, actually very soft skin, no callousing. And then we get around to the other side, the ankles, no scarring, the skin is nice and intact. So we don't have any signs of insufficiencies. Or, and do you have any diabetes?
No.
No, okay. So no diabetic ulcers, we just have this one concern here, which is the wound. So in this wound here, I use the end of this pen here to try to point things out. You can see we have the red granulation tissue inside the wound that looks nice and pink and healthy, but we do have some yellow slough forming in the wound and on the outside of the wound over here. And then we have some eschar starting to form. This black area may look a little necrotic, and at the edge over here is pulling quite a bit on the wound. As far as measurement of the wound, we need to go ahead and, what did I do? My tape measure is right here. Oh boy, oh, here it goes. Sorry. Tape measure is right here. So, the wound itself, lengthwise, waiting for it to focus on the tape measure, goes, sorry if I'm giving you a headache, Dr. J, for moving this around. It is 7 centimeters across, or lengthwise, and widthwise 2.5 at the widest portion, and depth well, we're just faking the depth measurement, but it is 0.5 centimeter deep. So we're looking at a full thickness wound in the center here, and then out to the edges more partial thickness, but this area could grow. So that is it for my assessment, and I hope from a distance that looks like a real wound. Okay, thank you. Bye-bye.